Let's go. So, hearty welcome, everybody. Thank you for joining Sjenade and I for the second session of our conversation we started last week on the power of Chinese medicine. So just a little recap for those of you that didn't join last week. We're going to be able to tie a lot of the topics together, so you don't have to worry about not having watched it, but the recordings will both be on my YouTube channel. So Sjenade is a longtime friend. She started as one of my students many, many years ago. We established it was 2 decades ago. In Cape Town, practicing yoga with me. And through the years, we connected. It evolved into a lovely, warm friendship. She's attended my retreats over the years. And the last time we saw each other prior to this was actually in 2019 when we saw each other in Italy, and then Sjenade came back to Cape Town and stayed with me for a while. In that time, Sjenade moved from the corporate world into the metaphysical studies, into Chinese medicine, into healing, and I think sincerely found her purpose because she's quite brilliant at it. She moved to China, studied Chinese medicine, so as a Chinese practitioner, and then during COVID had to move to Bali, where she hosts phenomenal retreats. She's a qualified advanced yoga teacher, and quite superb. So without further ado, I want to say a hearty welcome to Sjenade. Thank you so much for joining again. I'm so pleased we have this opportunity before you go back to Bali to just continue and dive deeper into the topic. So thank you and welcome.
Thank you so much for that introduction. Yeah, I'm really happy to be here. Thanks, Elaine. And yeah, I think it's great that we get to catch up again. I think there's a lot of tools, or not a lot of tools, but there's some things that I feel like we can kind of build on, where we can give everyone that's attending today some practical tools or some things that they can use in order to improve their general health and well-being. And there's some simple things that, it doesn't have to be complicated concepts. It's just really that I find is really, really useful for day-to-day understanding our energy from morning until night, understanding how some of the emotions that are going unprocessed are really affecting specific organs of the body. And we talked a bit about yin and yang in our last catch up, but today maybe from that we can work a little bit more into the 5 elements, because this is really the foundation of Chinese medicine diagnostics, and also how the organs are functioning, how they pair up in yin and yang organs and form specific elements, and then how this can be used in your everyday life. So yeah, I think that's really like my aim with all of this knowledge. I'm not finished studying. I've still got a couple of years to go before I am a qualified traditional Chinese medicine doctor, but I feel like there's already so much information that can be used, that's already treatable in the gross. We talked also about the different bodies, the energetic body, the gross body. There's a lot of treatment that can happen in the physical body through yoga and acupressure. That kind of bridges that gap between energy and physical body. So I guess that's just a little direction that I wanted for today. I just want everyone that's here today to just have a little takeaway. If it's a little tool that they can walk away with and apply, that would be really, really amazing for today's talk. So yeah, and also if we've got time at the end, I'd love to answer anyone's questions, but of course, everyone's more than welcome to contact me anytime. Happy to take calls or send voice notes or reply to messages, WhatsApp, social media, or whatever is also good.
Lovely. Lovely, lovely. And I can see as you're chatting, more people are joining, which is fantastic. Just for those that weren't here last week, just give us just literally sort of 2 minutes, catch them up with how you made your way, what to Chinese medicine, moving from the corporate world.
So natural medicine had kind of always been in the back of my mind. I kind of forced corporate and work and the things that I was doing, um, for various reasons, for many, many years. But the more yoga that I did, the more connected I felt that I became, to, yes, the subtle energetic body, or to the more holistic approach. I was also very sick in my early 20s. I was really unwell. My hair was falling out. I had serious issues within my energy levels. And this was like kind of the prompt to go into more investigation. And then, of course, meeting you, having your story, what's happened with my stepdad as a medical doctor who, in the opposite of what you did, instead of using traditional Chinese medicine or any kind of Eastern medicine to kind of support oncology treatment, was kind of like these two polar opposites. And he passed away in 2018. And of course, this was kind of like at the time that you were diagnosed, he kind of came out of remission. And the two of you, of course, underwent chemotherapy and things like that. But the difference is that you used Eastern medicine to support you through this process. And this was a big eye-opener for me. From there, getting into traditional Chinese medicine, studying in China, at the university in China, we have to regularly keep up with modern or Western, what they call Western medicine. And when we add traditional Chinese medicine into Western medical treatment, the results are exceptional. So, and there's no arguing it. The example that I gave in last week's talk was with regards to people with kidney failure. The doctors will turn around and say that you need to go on dialysis and you have up to 6 months to live. But if you incorporate acupuncture and in some cases certain medicinal herbs, patients are living up to 6 years. So some cases it's as isolated as just acupuncture. There isn't even any other treatment. It's literally using needles to insert into the body tissue, which targets specific energy channels. But now that we know a little bit more about anatomy, we understand that these energy channels do overlap certain nerves, blood vessels, they go to connective tissue. So now we know that overlap. So yes, it is energy. It's not purely with the blood vessels and the nerves and the tissues of the body, but it is also working into an energy channel. So the evidence for me out of the Western medical science is also creating even more of a positive argument for using traditional Chinese medicine. And there's a big drive in China, in Chinese medicine practitioners and in hospitals and things to produce results because they want it to stay alive. They don't want it to be these two concepts that are constantly fighting with each other. It's clear from the studies, not just with kidney failure. I mean, if you use acupuncture, you could use less anesthetic for all surgeries, for all procedures. You need less anesthetic. They can perform surgeries while you're awake because if they insert needles into specific nerves, it cuts off the pain, so you don't experience pain. Essentially, the same thing that anesthesia does. Women that are pregnant, if babies are breached, they go for acupuncture in specific points and the babies are born naturally in the correct way. If you want to induce labor, if you want to improve fertility, if you want to manage hormones, if you want to lose weight, if you want to manage your digestion, there's just endless amounts of information that is supporting the use of Eastern medicine. And I feel like it's super important because everyone should, like we said last week, everyone should have access to this information. If anyone's falling ill at any point in time, they should have as many options available to them to treat their dis-ease, as you so nicely put it last week as well. Their dis-ease, any kind of dis-ease in the physical body. So this for me is like why I'm really passionate about speaking more in 2025. I feel like I've been through the deep dive with knowledge in my as my own personal example, witnessing people that I love go through this, and then also looking at the scientific study when we worked with the oncology hospital or when we had to listen to doctors speaking and presenting evidence. At this point, it's like the more conversations that happen like this, the more people have access to this information, the better, the better. Even if it's as simple as what we'll talk about today, managing your emotional stress at the physical and the energetic level.
Yeah. That's amazing. When we started it last week, you shared with us, just a little bit of history for those of you that aren't as familiar with the Chinese medicine, but how the beginning of Chinese medicine was sort of started from the study of nature, correct? And observing nature and seeing
Yeah.
the cycles in nature are, everything has a cause and effect, and that the body is actually a representation of nature, and within the body exist the five elements. Won't you
Yeah.
chat to us about those five elements?
Sure. So this is what before I talk about the theory, I like to mention also when I'm talking to my students is that this knowledge is very old. So we need to cast our minds back into a time before the periodic table of elements and before microscopes and before really the anatomy knowledge that we kind of have now. Everything was an observation of interaction, yes, between nature, but this was before we could examine things under a microscope. This was before, chemistry existed as we know it today. So those five elements, they simplified it into the elements that we work with in diagnostics. They simplified it into five elements. And I have a little picture here, so I'm going to share screen, but I think this means that I'm going to disappear. This is usually what happens.
Yes.
But that's okay.
Is it sharing? Unless.
Let me go share screen.
Oh, there we go. Yes.
Yeah. Okay. So now if I flip over here, yes?
Yes.
Good? Okay.
Yes.
So these five elements are wood, fire, earth, metal, and water. And then each of these five elements are responsible for two or four energy channels, which are actually organs. So you can see under wood, we have the color green. This is also the color that governs it. So it goes into all of these things. It goes into color therapy. It goes into kind of like an energy and an emotion. It goes into specific related organs. So in this example here, or not in this example, specifically for wood, it governs these two organs, the liver and the gallbladder. So this is your element of wood. We'll talk a little bit more about that now. And then under fire, they talk about the heart and the small intestine and the pericardium and the triple energizer. But in this specific example, they're talking about governing your sympathetic and your parasympathetic nervous system. And then the earth is your stomach and your spleen organs. Metal is your lungs and your large intestine. So this graph is giving us other related organs. And then water, the two main organs is your kidney and your bladder. So we talked about yin and yang last week as well. Each organ is either yin or yang. The liver is yin, the gallbladder is yang, the heart is yin, the small intestine is yang, the stomach is yang, the spleen is yin, the lungs are yin, the large intestine is yang, and the kidney is yin and the bladder is yang. So within each element represents yin and yang, and the organs also represent yin and yang. So this is a cycle. This is always in a cycle. So I like to say wood, if you chop down a tree and you take the wood that you've chopped, you put it on the fire and it stokes the fire, right? When the fire burns down, it creates ash, which then returns to the soil. And this is earth. When the earth is strong and we dig deep into the earth's, closer to the earth's core, we get metal. And when you take metal out of the earth and it makes contact with the air and there's condensation on the metal, this is what generates water. And then water in turn will nourish wood. So this is how all the elements are interacting. So if we take a look at wood and we look at the liver and the gallbladder, we see that when these elements are in balance, what does it generate? What organs then follow? The heart and the small intestine. When we look at sorry, my phone was ringing, got a little bit distracted. When the heart and the small intestine, I hope it's not someone trying to get in on the call, but anyway, carry on. When the heart and the small intestine are balanced, then the stomach and the spleen are balanced. When the stomach and the spleen are balanced, this then nourishes the lungs and the large intestine, or the colon here. When the lungs and the large intestine are balanced, then the kidney and the bladder is nourished and in balance. And when the kidneys and the bladder are in balance, then again, the liver and the gallbladder are in balance. So the important thing for us to remember here is that nothing functions in isolation. We said yin and yang cannot exist on its own. The same elements. So they call this the generative cycle. They call this the generative cycle of the elements. This is how, so they observe a tree and they understand how the liver and the gallbladder give us our flexibility, our growth. And when they looked at fire, this is that energy of the heart. It can either trigger, a lot of fire can either trigger the nervous system to react quickly for the heart rate to increase, or it can slow things down. It can work into the parasympathetic nervous system and slow things down. So they looked at all these interactions and they saw, okay, what nature does, actually, there's a metaphor almost. There's like a story from nature that the body also uses, and the body interacts. So, and this is how they develop kind of like their diagnostic system. So they, a lung infection is not a lung infection. A lung infection is an imbalance in your metal element. And it could be related, yes, to a virus or a bacteria, but they look at you holistically, like we mentioned last week. They're not just going to look at you as a standalone. They look at it holistically, so that we can see, the lungs whole. When we look at the emotion theory, they look at, well, what emotions are you undergoing? Because if you're under intense emotion that affects the specific organ, it's going to weaken the energy of that organ. We talked about qi last week as well. It's going to weaken the energy of that organ and then make you susceptible to infectious diseases or tumors or growths or anything like that, or any kind of disease related to that specific organ. Cool. Should I keep going? Wait for cues? I can't see one, so I'm just keep talking. I can see you, Elaine, but I can't see anyone. So I'm just
ask a question, because this is something I've always been interested in. Like I can understand how sort of the kidneys and the bladder is a water related element. How did they actually get to connecting the elements with the organs? Like, I suppose fire, the heart is passion, but how does one remember where the elements connect to the organs?
It is looking at their individual function. So this goes a little bit deeper, because there are the two organs, but there's also smaller circulations with other organs. So yes, the kidneys and the bladder are responsible for cleaning out your water in your body, but it has a small circulation with the lungs. So the lungs with the kidneys regulate your body's water, but how they function and also what they take from the body is how they connected it to the specific element.
I follow. So it has to do with understanding the functionality, the anatomy of the organs a little bit deeper. But it totally makes sense. Okay, one just has to sort of be able to have more medical knowledge to remember it. Daphne's asking a question. Yes, unmute yourself.
If I'm understanding what you're talking about, the way I remember these different elements and is that water feeds wood. Water is the mother of wood.
Yes.
That's the way that I got it. And then wood feeds the fire.
Yes,
So it's
exactly.
just that was my beginning of getting the process. So you can explain it better.
Yes, so they actually call it the mother-son
Yeah,
generator. Yeah.
yeah,
Yeah, exactly. Exactly. So wood is the mother of fire.
yeah.
Fire is the mother of earth. Yeah, exactly. Yeah. Yeah. So also, Elaine, to answer your question a little bit more, when you go into the emotion theory, it also answers your question a little bit. So I'll introduce that, and then I can give you an example of how they relate these two. So I'll share my screen again. So this is one of my favorite pictures because it really explains how we process emotions and how they fit into the functioning of the organs. And also sometimes if you feel like you're experiencing an emotion, you can actually relate a physical reaction in the body to that emotional experience. So they say the lungs hold sadness and grief. The heart is cruelty, hastiness, impatience. The liver is anger and frustration. Fear and worry are two different things. Fear sits in your kidneys, and worry or anxiety sits in your spleen. So these are specifically yin organs. These are specifically the yin organs. So we can recap the elements. The lung is metal, the heart is fire, the liver is wood, the spleen is earth, and fear is the kidneys, and fear is water. So if you think about it, have you ever been like so scared that you almost pee?
Interesting.
Okay, fear, right? Have you ever had a cry where you go, you know, that one where you like gasping?
Yeah.
So where is the gasp? The lungs. When you've really had a cry that is so full of grief and sadness that you're like, you know, you've got to take that like gasping breath. There is that emotion. This is from pure observation in the physical body. Anger, I think, is quite an intense one because I don't know, a lot of us kind of like get hot in the head, or we kind of feel that rising. I don't know. We can also discuss. I don't know, everyone experiences emotions a little bit more different, but maybe after an intense bout of anger, observe. And I think as yoga teachers as well, if we're practicing any kind of, I also mentioned this last week, if we're practicing any kind of like healing modality, or if we become sensitive to energy through anything, through Reiki, through a yoga practice, through a meditation, through breath work, or whatever it is that you do as part of your daily practice, you become very aware of like the sensations in the body, right? Your body awareness grows, you know, like, oh, I've got this pain in my right side. Oh, actually, I'm like fuming. I'm furious, you know, and where is your liver located, you know, under your right ribs on the right side. So it just, you can also become aware of this, of where these emotions are sitting and where you're feeling it in the physical body helps you make that connection. And this was from pure observation. For worry and anxiety, you know, if you're really worried, do you have an appetite? Do you want to eat? You know, you generally not, you know. If you feel like you've really been done wrong, you know, your entire posture changes. You know, your shoulders kind of hunch forward. You're kind of like your heart is not open, right? It becomes closed. So we think about where cruelty or nastiness comes from, and what effect that has on the person that's receiving that emotion. What it does to their physical posture. They no longer sit up straight. They're trying to close their heart off. So the emotion theory is amazing because I feel like we all have a specific example that we can relate to this. And then it becomes so clear how this organ and this emotion is related. So, and also when you cry, so what I mentioned earlier, to understand there are also interconnections between these organs, or what they call like small circulations or collateral circulations between the organs. If you're sad and you're experiencing sadness, you tend to cry. So you're also releasing water out of the body, not only through the excretion that happens with the work of the kidney and the bladder, but you're also releasing water. So of course the lungs and the kidneys are going to work together to regulate the body's water.
Amazing.
So yeah, so as you go deeper and deeper into it, it kind of like reveals another layer. And all of it is so connected to how we live and how we interact with the world around us and how we express ourselves, and how unexpressed or expressed emotion either makes us feel or not feel. Yeah. So this for me is super interesting. So if you're going through extreme grief, you've got to you can start to look at it where you've weakened the lungs to such a point that their energy or their individual chi is weak. And what tends to happen, you get a really bad cold. You get a really bad chest cold. This is very likely. If the heart is imbalanced, then you're going to start to have cardiac issues. If there's no joy that sits there, because actually the balanced emotion is joy in the heart. So if this emotion is imbalanced, then yes, you're going to have complications with the valves in the heart, or with the arteries, or with high blood pressure, low blood pressure. You're going to have issues with the functioning of your pericardium, the protective sac that the heart sits in. So this for me became very clear. There's also some studies that have come out to deal with heartbreak, and it's super interesting because the element of fire here in this example is talking about the heart and the pericardium. So just for anyone that's unclear about the pericardium, it's that protective sac. It's like a special kind of muscle tissue that sits around the heart, and then the heart beats within the sac. And to keep in the gap in the sac of the heart and the pericardium, there are these fibers that kind of exist. And there's a reason why it's called heartbreak as well, is if you're experiencing an intense emotion that's related to the heart, whether it's there's just no joy, or there's that hastiness, impatience, cruelty, that kind of those things that are related to these feelings, or just like extreme loss. That heartbreak is represented in the collapse of these tissues between the pericardium and the heart. They actually break. And there's actual evidence of it. This is why they say, oh, my grandma died and then my grandpa died of a broken heart. Actual physical evidence to show that the casing of the pericardium collapses because those tissues, those fibers in between the heart and the pericardium that are holding it in place actually break. That's how intense emotion can affect the physical tissue of the body. I'll see if I can find the links, if I can find the links to the science studies, but this was also a very interesting read because it's so related to the traditional Chinese medicine emotion theory. It's so clear.
Yeah. I want to add to that, because while I'm looking I love graphs and they make so much sense. I mean, if I think about, for example, my dad, he had a heart attack when I was quite young, but, at that point in his life, he was, besides for the food, besides for the stress, the emotion was also, he also had a lot of impatience and kind of unresolved anger. issues, and unresolved relationship issues. Later on in his life, not working through those, I looked at your diagram, and there's that link between the fire, and then it went down to the lungs. And later on, he landed up having lung cancer. Water on the lungs, these unresolved, how the fire and the water were clashing. And it is just so interesting when you start linking the different organs, the different emotions. It just makes so much sense. So you can see there, Sjenade bringing it up. The fire is the heart area, and later on, with unresolved issues, went straight to the lungs. So, and there was also, it says skin there. He also had shingles. A few years, probably a year before he passed, while he had his cancer. So this is so fascinating. I mean, this is a real proper, this is the four bodies really connecting. This for me is such proof that you can't just look at the physical body. We are so much more than that. We are the four bodies, and really just considering all four, and how the effect on how it affects our health.
So clear why we can't. Oh, can you hear me?
Yes.
Okay.
I think my just let me know if my Wi-Fi is stable enough. Yes, it looks like it is.
Yeah. So this is also so clear why we cannot only address a symptom. Why modern medicine only takes us so far, and why it's so important for us to look at each other in this holistic view. Why is it so amazing to use this knowledge? It's because it looks at us in this holistic view. It's not only, it's about your experience through the world. This, we know, is going to dictate our level of health and wellness, our mental health, our physical health, our emotional health, and how this then impacts, with how disease does or doesn't show up in our lives. So the cycle that you were speaking of, where you drew the connection with your father's case, is spot on. And it's also indicative, and Daphne can also share this because I'm sure she knows, there's also an over-restraining cycle, where if the fire is too much, it is going to melt the metal. That's the connection.
Yes.
And then if the metal is too much, it's going to chop through the wood. So it skips water and it goes directly into creating problems at wood. And if the wood is too much, it's going to skip fire and it's going to go straight into the earth. It's not going to generate enough fire, and it's going to create imbalance in the earth. So there's a generative cycle, there's a restraining cycle, there's an overbearing cycle. This is the one that's represented here, is where there's such an imbalance in the element that it skips the next one in the cycle and completely negates the generative cycle, and then starts to. So this is also why, if you think about it with metal, with the skin, it relating to the skin as well, it's yes, if you're not eating healthily, because in the generative cycle, if you're not eating healthily, your digestive processes are not good, it's going to be reflected in your skin. But also, if you're having issues in your fire element, this is likely. If you think about things like eczema and dermatitis, it's like all these hot, itchy, scratching, fidgeting, diseases that kind of manifest in the physical body. And this is how we know that it could be related to rather the element of fire, and not always necessarily. This is why it's not only about what you eat, it's also about how you feel. It's also about what's going on in the heart.
Yeah. It's so interesting. I mean, I've being open here, but I've had a lot of issues with eczema for many years. And it comes and it goes, and then it manifests in other ways, which is that constantly evolving and growing and needing to let go. And So interesting. I mean, one could spend just weeks, years studying that graph. I get it, there is so much, but it's been so beautifully put together because it just is really a volume of information, encyclopedias of information in that graph.
Yeah, so the traditional Chinese medicine doctors don't, they go into clinic and they actually have to present their cases to their elders. So, there's weekly consultations with the diagnostics. They don't only, they'll be treating patients in the clinic, but once a week, all of the doctors and the elder doctors who are so revered for their experience in diagnostics also meet together and they review cases. They have to, because there's so much minute detail. And it's like, well, okay, this person is experiencing X, Y, and Z symptoms, but you didn't look at the color of their tongue. So this then changes the entire diagnosis. Or you didn't consider the relationship with this person's family. Do they live on their own? Do they have regular interaction with other people? What is their job stress like? What are they eating? So this is why it's so incredible at treating root cause. It's not just going to mask the symptom. It wants you to look at every single aspect of your life. It's not in traditional Chinese medicine, there's a saying, we heal in all four directions. We heal in the north, we heal in the south, we heal in the east, we heal in the west, but we also heal in the past and we heal in the future. We don't heal only in the here and now. Yeah. And this is an indication of how they're looking at individual patients and how they're looking at your individual and very specific case.
That's brilliant. I mean, just for those of you that weren't here last week, and I know I had brought it up last week, but where this, just makes so much sense and it brings it together was I saw this in a graph that, just was presented to me as a download almost when I was sitting, and we chatted about this when I went through chemo in 2016 and 17. I remember sitting in the oncology room, and the ladies there had either breast cancer or colon cancer or ovarian cancer. So theoretically, we all had the same disease. But no, not at all, because I had chatted to these ladies, and the one lady had gone through a miscarriage. The other one had gone through a divorce. One had nutritional issues, which manifested as diabetes. The other one had addictions. These are all very, very different diseases in its, so one was like physical, there was physical, mental, emotional, and energetic, but they all were labeled under the same umbrella name called cancer, where fermented cells are just, not behaving properly and creating this mass and tumor. But what I was so blessed to be able to do was, like you said, do the Chinese medicine with a really good Chinese doctor. And, I would go for my chemo, which was the necessary evil, and then go and see him the next day. And it wasn't just a matter of him giving me medication. There were pills and there were formulas, but he would, like you said, he would check my pulse so that he could see the different organs, check my tongue. He also would do therapy with me. So I did a lot of psychotherapy, and that was so important. You can't sort of just focus on the physical body when the emotional body also needs fixing. And in all our four bodies, we might not need all four bodies fixed. We might have two that are, doing quite well, but we might have an issue in the heart and a trauma that someone needs to help with, and then it's sitting in that organ. So I love that this is a now broader and more open conversation, and the hope that it becomes the norm. And this, like we've said before, this is the yoga, right? Because that's the union, that's the coming together of West and Eastern medicine.
Yes, for sure.
Mm-hmm.
So, yeah, I mean, it's to have lived through that experience, Elaine, and now be able to give insights, kind of like from the other side, is incredible. I think we all need to make peace with the fact that at some point, the physical body fails for whatever reason, whether it's part of the lesson that our souls came to learn here, or whether it's really trying to teach us something. I think you said this to me, is you felt like it was trying to teach you something. There was something here. It wasn't. And if we can all adopt this approach, there is so much healing to be had in understanding this relationship. And I mean, I didn't have cancer, but I was on the brink of an autoimmune disease. I mean, nobody could tell me what was wrong with me. But I'd wake up in the morning and my pillow would be full of my hair, or I'd just have no energy at all. And I was young. It was a life stressor. It was a severe traumatic life event that affected my physical body so much, or that I wasn't addressing in my energetic body to the extent that it was manifesting in my physical body, as maybe I was confused and the disease was expressing itself as confused and not only just one thing, So I think we've all got stories where we can relate to this theory in some way, and that's the important part. That should be the focus.
Yeah, absolutely. And there's that wonderful word curiosity. But I think I want to sort of just redefine something with the word curiosity, because I've seen how curiosity for some people could be something maybe like, let's go to controversy, but curiosity on an individual level, in terms of connection, it's about finding good, finding purpose, finding peace. And to heal, that's the curiosity that brings answers and connection and resolve.
Definitely.
Without that curiosity, if people don't have curiosity, then you can't really support them. So that's also an interesting thing, because you had said, watching the difference between your stepmom and stepdad and me, but what it is, and I'm sure you seeing this as well, as a teacher and a therapist, you can only, it's that old saying, you can only help those that want help. And then that are prepared to participate. Just by being open, just by being able to receive, just by, listening with interest and regard.
And I think as well, from the other, from looking at or from my experience working with professors, or learning from professors or lecturers or doctors, is from a traditional Chinese medicine doctor's perspective, or their approach is always this, how do I say, it's always this of like extreme compassion for the individual's experience. It's like we also talked about this tipping point last week, that kind of like that takes you over the edge. I think, yes, we can all accept that we are at some point going to leave. The physical body will take us only so far, but the beauty of this is that we can age well. We can age and we can stick around for longer, if that is our will, and that is our, if we work with our physical body a little bit more, because our life expectancy is only taking us as far as we are connected to our body's natural impulses, and it's natural flow, it's natural cycles. And this is why, I feel traditional Chinese medicine is so strong in this area, is because, okay, I mean, I said as well, with regards to my stepdad's example, I mean, I'm not saying that I could have changed the outcome, but the suffering could have been reduced.
Yeah.
The amount of pain could have been reduced. The managing of the symptoms could have been a lot better, even if that's all that we do. Like, we're never going to, perfection doesn't exist, right? But we can get pretty close to it if we listen and adhere to this natural rhythm, the body's natural rhythm. So I think for us as well, if we think about doctors that are leading the conversation in terms of longevity research and in terms of, we are living longer than we ever before. And we want to do that actively. We want to do that without being dependent on someone else. This is also another aspect of it. If we keep illness at bay, amazing, but what we want to do is make sure that we are mobile, that we are energetic right up until the very end. These are also things that traditional Chinese medicine helps with in terms of our overall health and well-being. We want to have a healthy outlook of the world. We want to have healthy perspectives. We want to interact healthily with other people around us. This is also governed by how well our liver and our gallbladder is functioning, because that's going to dictate how we manage our anger and frustration. If we are experiencing extreme grief, of course, we need to understand that breathing is going to be such an important part of that integration process. This is why breath work is so effective in addressing certain traumas that sit in the body. So all of this can be addressed under the emotion theory with the element of water, with the kidneys and the bladder as well. If you think about where your adrenal glands sit, they sit right above your kidneys. And if you think about burnout, your adrenal glands become completely burnt out. How many of us are really acting continuously from a perspective or an emotion of fear? How much of what we do is dictated and governed by how fearful we are of certain outcomes, of our financial security, of losing a loved one, of our possession, or whatever it is. How many of us are actually living in fear? We're depleting that energy of the kidneys because our adrenals are constantly firing. We're in this constant state of fight or flight. If we are excessively worrying and overthinking, we're going to damage our digestive process. How many people do you know are struggling with bloating, bacterial issues, bacterial imbalances in their large and small intestines? How many of us are suffering with heartburn and stomach digestive issues? Stress. I've had young friends of mine diagnosed with severe stomach ulcers and digestive issues. If you're worrying and you're overthinking, it's going to manifest there. There's only so many antacids that you can take. There's only so much ulcer medication and so many cups of coffee you can skip before it's like, this is a serious issue and I need to address this at a deeper level. And this theory offers us that opportunity to do it before it manifests as chronic disease. Yeah. So also the important part is not only about, because this is this example of cancer or tumor or growth or in this term of chronic illness is also a completely different approach. But how do we, before it even reaches that?
Absolutely. What I love about it, and I could pick up from, I'm sure everybody could pick up as well from when you were talking, that very big difference, and I could feel it with the integrated oncologist who was trained in Chinese medicine, was that very individual sense of support I felt going through it. Yes, I had to participate. I had to do some work. I had to engage in, of course, it's my body. Nobody's going to look after it better than you. And if you aren't looking after it, why? And the second point being, the blue zones are based on the premise all of exactly what you've just said, of how Chinese medicine practitioners and healers look at health. Because those blue zones, people are living much longer, much healthier, because they are looking after their physical, mental, emotional, and energetic bodies. So much.
It's not only, you've got to really, life doesn't exist. Like, we all know that, My mom always says life is what happens when you're making other plans, It doesn't exist only on this one track. You've got to, and what I don't want is for people to unnecessarily go down the spiral of disease when they don't have to.
Yes.
When you incorporate Or if you're not going to do yoga and you don't want to be upside down and, if you don't want to do that, then do Qigong. Meditate for 10 minutes, stop, set a timer on your clock at your desk at work, get up, go for a walk, breathe, check that your diaphragm is being exercised when you're breathing. If you're breathing up into your chest, this grief, it's just all going to build up here. It sits up in, this is why people walk around like this. You can see it in physical posture. You can see it manifested in your physical body. It's your tissues then start to respond and reorganize themselves based off of how well or how not or how unwell you're processing the emotion. So you have to really, it's about this. And I know it's scary. It's go slowly, but if you're giving yourself 5 minutes of breathing at regular intervals during the day, you're already doing wonders for your energetic body, and therefore your gross body, your physical body.
And knowing that there are people like you and me around who can support the process, never feeling like you have to, dive into this process alone. Where do you start? That's why making this information available, and there are people that are practicing and offering therapies like you are. So I think that's so important that people stop feeling like they have to do this all alone. That overwhelm doesn't need to happen. Very, very important.
So if I get kicked off of this meeting, I'll just join back in because I'm not sure what subscription I'm on Zoom. So sorry if that does happen. So far, so good. So just throwing that in there.
Okay.
So, I'm open to getting feedback as well from everyone that's on the call. But I think also one of the let's quickly look at the top 3 things that are not necessarily chronic illness, but that's plaguing a lot of people that you know. And Elaine, we've already talked about anything digestive issues.
Yes.
Right? There's a small intestinal bacterial overgrowth is a really big one, or fungal overgrowth, Candida albicans, chronic yeast infections. So let's say anything that's related to the digestive tract, from like kind of the stomach all the way into the excretory organs. I feel like this is a big one that people are struggling with.
Yeah.
The other one I can identify is mental emotional disorder. Whether you want to give it a name like depression or anxiety or paranoia or whatever word the what Western medical science is giving it. I feel like mental emotional issues are another big one. Big. And anxiety as well, right? Just in general feelings of anxiety. So those are the 2 ones that stick out big for me. The other one is back pain, unexplained back pain, or just unexplained pain in general, right? So for me, these are like the top 3 standouts in terms of issues that we're treating. So if we look at what we know now about the emotion theory and the 5 elements theory, if we think about anything to do with digestion, stomach all the way down to the excretory organs, I'll bring the screen up again, and we can look at how this is connected to this and how important it is, and also maybe a few things that can help us manage this a bit better. Okay, so for digestive organs, we've kind of got the stomach and the spleen for sure. Those are going to be your big ones. So here we talk about the earth elements, and the most earth elements that we're going to get is what we're eating. So nutrition is going to be the cornerstone of that, and it's quite a difficult thing that we need to tackle. I know people that are struggling going through, elimination diets or mono diets. They just eat one thing to see if they can correct it over time. So food is going to play a really, really big part. Your nourishment, what you're putting into your body, is going to play a really, really big role in sorting that out. But here it also mentions contentment, stability, your adaptability, and your capabilities for empathy and care. So yes, we can see a nutritionist and a dietitian, but we need to look at these energetic things, these emotional things, energy in motion, emotion, energy in motion. We need to look at these things in order to get these right. And this is just not happening. And people are getting so frustrated with, oh, I'm so bloated every time I eat this. But actually, how stable is your environment right now? Are you going through periods of massive change? How well are you managing that change? Can also be related to creating imbalances anywhere in the digestive tract, but specifically in the spleen and the stomach, which we then know goes into your colon, your small intestine for absorption. Your liver and your gallbladder do also kind of like play a role in that digestive process, for the gallbladder excreting bile and the liver being able to break down sugars and fats and proteins. So if we look at more things to do with digestion, if it's specifically bacterial overgrowth in the small intestine, that's not going to be earth, and it's not going to be metal, water, or wood. It's going to be things to do with your element of fire. And this is your relationships and your capacity for experiencing love and joy. How much of that is existing in your life. Other things to do with the digestive tract is your colon, in the metal element. So, how well are you processing traumas related to grief and sadness? How are you coping with loss? Are you clinging on to things? Are you holding on to things? Constipation, yes, it's a water imbalance. It's the presence of fats in the body. But also, this is the last thing that needs to happen with your colon is it needs to let go of the waste. But it's a metaphor for how tightly are you holding onto the waste in your life, in other areas of your life. And so all of these things, and it's going to be individual for everyone. I might not be sad. I might be really eating crap. So of course I'm going to have issues with my digestion, but that's how I differ from the next person who's going through processing extreme sadness or processing grief. So this is also how it comes down into those subtle differences and how everyone is different, because I'm not at the same experience level as the person next to me, and how my physical body is processing that is going to be different. I might have the same symptom, but it might be the root cause might be something completely different. So this covers kind of like digestive issues. The next one is your mental, emotional, but I want to leave that one for last because we touched on it a little bit last week. But it's also to do with the spirit of that specific organ. And then the other one was to do with kind of like back pain or unexplained pain. So I feel like this is also split out into nutrition, but I feel like the three main organs related here are going to be your water, wood, and your earth. Yeah. So if you look at the kidney and the bladder, it also works with the bones and the endocrine system. So this is like your hormonal secretions. And the earth as well. Earth is great because the stomach and the spleen are said to govern the buildup of muscle tissue. So tissue fiber in the body as well. So if you think about it, if you're gymming really hard and you're not nourishing your body properly, you're going to have that pain in the muscles excessively. It does hurt 2 days after the gym, but you could reduce that pain, for example, if you were sorting out your nourishment, if you are making sure that you are properly hydrated. Bones and joints are impacted by how dehydrated you are. And this is clearly represented in this diagram as well. Why I say wood is because the diagram also says or notes here that we're speaking about flexibility. So not just flexibility in, how flexible are you in a work environment, but if you're going to be overly flexible and metaphorically bending over backwards at work, this will manifest as tension and frustration in the body, which generates pain of some kind. So we need to manage our fear, what is our courage and our willpower looking like in terms of our kidneys and our water element. We have to look at how stable our environment is, how adaptable we are to balance our earth element to manage pain. but then also specifically, how well are our liver and gallbladder performing, which can also then generate digestive issues. But in terms of the energy channel, manifests as physical tension along the IT band, so along the outside of the hips, pigeon pose.
Yes.
That's your gallbladder, and also on the tops of your shoulders. Your gallbladder has 2 points on the tops of your trapezius, and this is going to manifest as tension and pain in the shoulders, and then also in turn create things like tension, headaches, and unexplained pain in the shoulders, pain in the upper body, poor posture, that kind of thing. The other one for mental, emotional, and I think traditional Chinese medicine explains this so well, is that the mind is the secondary thing. We also mentioned this last week. They call it an extraordinary organ. It does not form the foundation or the basis and treatment of disease. If you want to look at mental, emotional disorder, it exists in the heart.
Yeah.
True understanding of the world around us, if we had a balanced perspective and we worked on our acceptance, we worked on our capacity for healthy relationships and love, the likelihood of us severing that connection between the heart and the head and then creating the imbalance, which Western medicine calls depression or anxiety or whatever words they're giving it, is looking at the heart, and specifically the heart. And no Western medical doctor will tell you that. And that for me is, or very few that I know of, because it's give them a chemical to regulate the chemical in the brain. It's not what's going on over here. So the research that you can go and do, I also send a little bit of information around it. There's some great articles that were written in, I think it's called the Acupuncture Journal, about the Shen, Shen. This is the spirit that resides in the heart. It's this celestial, heavenly, cosmic connection. That's the spirit that exists in the heart. And if we want to ease what Western medicine is calling mental disorder, it actually needs to be addressed in the heart.
Sure.
So those are the 3 biggest issues that I'm seeing. So, okay, other than things like endometriosis, infertility, irregular menses, non-existent menses, oh gosh, I feel like that's a whole another talk, but I won't do that to y'all. But maybe, sure. This is a whole other talk, because there is this close relationship to food, and specifically also your earth element and other extraordinary vessels that are related to this. But I feel like these are the recurring topics. Yeah. These are topics all the time. Cystitis, endometriosis, irregular period, ovarian cysts, issues with infertility, cervical cancer, growths in the uterus, anything that is to do with the growth as well. And now that we've covered the elements, is to do with earth. Okay. If your earth is balanced, the tissue in your body is not going to be spread out the way that it's supposed to be. What is endometriosis? It's the growth of cells that shouldn't be there in that organ. We have different kinds of cells in the body. We've got smooth muscle tissue. We've got, we've got all different types of cells, and they have specific functions. Endometriosis is the growth of those cells in the wrong place. So this is related to the element that governs the tissue, and that's irregularities with the stomach and the spleen, and that is directly related to nourishment. It's directly related to diet. So yeah, and I know people that go and have hysterectomies, or they go have an ovary removed, or I know the nutrition part can be quite a divisive, controversial discussion, but I do feel like it's one that we do need to start having. I mean, I'm completely open to meeting later in the year.
Yeah, I think that would be amazing.
I know other eager guests and topics that your guests also want to hear about. But yeah, it goes so deep into all of these, and why is everyone has these issues? Everyone seems to have the same issue. There must be a related root cause. Yes, an individual person and an individual experience, but we also cannot ignore what the collective is going through, and how what the collective is going through is going to impact our individual health as well. So yeah. So I know we're getting on in time. The last thing I want to leave you with is, if you can't sleep tonight, everybody, you can't sleep tonight, there's a point in between your eyebrows. It's called intang. It's an acupressure point between your eyebrows. And you can massage this clockwise and you can massage it anti-clockwise. And if you're ever struggling to sleep, close your eyes, lay down on your bed and do this for 3 to 5 minutes. You can also stroke up towards the crown of the head. And then the last one, because I know everyone's struggling with anxiety, the last one is on your, gosh, my camera is so messed up here, I don't know. The last one is on your wrist. It's for your pericardium and your heart. So it's a bit difficult for me to turn my wrist, but if you take your 4 fingers from the crease of your wrist and you place your thumb in the center, you can feel it between the 2 tendons in the arm, clockwise, counterclockwise, 5 to 15 times, 3 to 5 minutes. This can also calm your anxiety and also prepare you for sleep and a good night's rest.
Have that, because I need that. Very menopausal woman. That is brilliant. You know, I listen to you and I love this conversation, and there's so many threads that I really would like us to chat further about, because we're both passionate about it. And I just think it's so important to share this information. But you know, what it also does is it like very blatantly reveals how, you know, I have, you know, utmost respect for Western medicine, very grateful, but it's incomplete. It's just a section, you know, and it really requires, and it's asking, you know, where people's health is going today, you know, and where things are more available, information is more available than it ever was, to look at the bigger picture, which is what Chinese medicine does. I mean, I almost feel like, wouldn't it be amazing if on a very like primary level, they started introducing, and maybe they do this already in China, but they start introducing these aspects in the schooling system, right? From grade 1. So that this becomes like a natural understanding that humans start having of their body.
And this yin and yang and this kind of like Taoist theory is the cornerstone of Chinese culture.
Yeah.
Understand the importance of drinking warm water over cold water. They know when to drink chrysanthemums in their hot water in the winter because the air is dry and it helps lubricate the lungs and regulate the water body. They understand the importance of eating seasonally and eating seasons. So it's all linked into, it has to become part of the daily routine and linked to the culture and how you celebrate meals together, and you know how you
the heart.
Exactly. Yeah.
I want to quickly just open up to everybody that's sitting here. Is there anybody that wants to ask Sjenade any questions? Well, yeah, would be take advantage. What I am going to do is share all of Sjenade's information again, how you can get hold of her, how you can do any consultations. She's available on WhatsApp, on email, the social platforms. She also does run retreats in Bali. And did you say you've got one in Sri Lanka?
No, I'm teaching workshops in Sri Lanka next month. But our retreats and yin yoga, acupressure, traditional Chinese medicine theory teacher trainings are 11 days. And we do them on an island called Sulawesi. And yes, there are retreats happening on Bali as well, and then in Malaysia, in Borneo, in Malaysia.
Lovely, lovely. And I will share my yoga retreat that I'm doing in Greece this year as well. So
On
that
maybe on my birthday, maybe I can get there.
is so amazing, so amazing. And then I'm thinking like, and then beyond that, we need to collaborate and do a workshop or retreat or something, but like an immersion into health.
I would.
I'd love to create that. And yeah, I think there's a need for it, and I know that a lot of people would love that. So, I just a huge thank you, Sjenade. Thank you so much for coming again. I'm just like, you've re-inspired me. You know, I think that's so important that we recognize like we've got to be able to help each other, just fill up our teacups, and mine is definitely so much more filled now. I'm so excited, and you know, you just recognize the the nuances that just help you get back on track. Thank you to all of you for coming, because I did need to set this start up conversations again, and it really has everything to do with, as much as I wanted to, and I spoke to Sjenade about it, but she was like, okay, let's set a date. I was like, oh, you mean now? And I think I would have just like, oh, maybe next month or whatever. But so thank you, thank you. Thank you for your wisdom, your kindness, your friendship, and sharing for both weeks. I can't wait for more. So we'll definitely do more in the year. So lots of love. Thank you to all of you for coming tonight. And yeah, just look out for the next one. It will be in the next few weeks, on something really interesting. I have no doubt. Okay, everybody. Good night.
Bye, everybody.